Oh, you're good.
We did.
I did sports for my school. Okay.
You go with you.
Sir.
Frank.
To you, I believe it was the barn police investigation. Yeah, I went to, I've been following.
Typically, I waited 2 hours for an interview I was trying to get, and they called me at 12:23. Hey, we're ready.
Where's lunch? But I had you guys on. Had you guys on at 4, and I saw your head, and you're like, oh, it's just wrapped up in the investigation.
Oh, thank you.
I was one day, 1 week, but I didn't check. So I sent our best email. I was like, investigation is over. I'm taking it out. On you guys.
I wasn't supposed to do it that day. Somebody else. Stuff happens. Somebody does.
What's up? What's up, brother?
Yeah.
And so they were following it. They got sent on something else.
Good looking court.
Yeah, believe it or not, it's easy to photograph.
Well, good for him, but.
We'll send out a digital handout with the flow chart and all of the pictures and all the shots. And
You know we love taking
craft, and you know what to do.
Yeah. So is Mike.
In November. You know why? Because we're givers. We're givers.
You send Bob up for a mic check.
You need a mic check? 1, 2, 3, 4. 1, 2, 3, 4, 5. Mic check. Anybody need a white? You guys need a white? Okay. Pretty good?
Yeah.
Good.
I was talking to you on email.
No, man.
All world.
My mom was in the ER. She had a position to do it. So down. Oops, sorry. Trying to get out of the way.
Oh no, you're ahead of me. You're good.
I tried to say it yesterday, and nobody got back to me. To an orthopedic office. You read them? Well, our doctor, she's from Simi, and he's got to finish up down there, and then he'll be back to where we are. I go, where's it going there? I'm not really sure, because this everything's gone. Got to go like 11:45, and I go, I thought you were going to try to shoot for 1. I said, 1 was the dead time. At 1 o'clock, I'm no longer available.
The others aren't doing that like that.
Pulled in the parking lot. It's 12:46. We were waiting outside. We were down to 12:53. Here we are.
We were lovely. We were sitting on the Wymore Road, just sitting there at 12:30.
Beautiful. Traffic was all jammed up because the right turn off of Wymore onto Lee was coned off, so everything was jammed in one lane. So it's backed up all the way to the office.
That's not bad. You gonna have them both done today, or is the other one?
Oh,
Come on, man.
yeah.
You been away that long?
Well, I thought orthopedic surgeon, that sounded a little more in depth than.
This at 4, that at 5:15, this at 5:30, both at 6. Miss it?
No, I don't.
But you don't like
Are you on
working all the holidays, working sunrise.
The holiday money's good, but I'm good.
Yeah, I work both days. I've been here long enough.
I'm working Christmas.
I'm sure I am.
I haven't been here long enough to get that out either.
You only like what, the second or third most tenured person?
5th?
No, fifth.
Well, tied for 4th actually. Me and Meredith are tied for 4th.
And I'm like 10th.
That's lovely.
March
So-
21 years.
The 2 guys on the top of the 2 pyramids, those are the 2 big guys.
I will
So the
indeed.
guy at the top of the left, the guy at the top of the right, those are the two kingpins.
You got it?
Yeah.
And the red underneath those are all the RICO charges, and again, those will all be in the digital handout, so you'll be able to see.
Okay, so those two guys will be singled out, because you know how they are about all of these things. So we'll be able to single out the two guys.
And the two guys on the bottom list are the ones you see represented here. This is the work schedule of the dope dealer.
This is the when to work schedule?
This is
This where they
real
schedule their time
time.
off?
This is going back like this month.
Are you on time of day?
Yes, time of day, but it's not accurate. It's like a half an
So
hour.
1:30 is 3 o'clock.
Well, if we're all ready, we'll get started. Thank you for coming out. What we're going to do is talk about a protracted investigation that we worked here in Seminole County in collaboration with all of our city police departments, as well as the Seminole County Sheriff's Office. We're calling this Operation Sundown. And there's some photographs on display, but we'll get to each one of these photographs as I talk about kind of what is featured here. We first talk about in Seminole County we have what's called the City County Investigative Bureau. And City County Investigative Bureau is an undercover narcotics vice task force that all of the city agencies that are represented here with our partner chiefs of police and city government come together to eradicate both street level drugs as well as more sophisticated organized criminal enterprises. And what we're going to talk about today is our successful case on two of those. We did this case in partnership with DEA and HIDA, which is the High Intensity Drug Trafficking Area. They helped fund our operation. It was a 5-month-long operation, and 2 criminal enterprises were disrupted as a result of that. The photographs on the side show kind of a breakdown of 2 people who were in charge and key runners that were on the street that are pictured there below, and we'll give everybody the names of those individuals. These 2 groups were responsible for bringing in thousands of doses of heroin, fentanyl-laced heroin, as well as cocaine. Actually, it was more than 22,000 single-dose packets of fentanyl, deadly fentanyl-laced heroin. And you can see just one of the packets here with these individual dime bags that were being distributed. That drug was coming into Seminole County exclusively, but particularly Longwood, Lake Mary, Sanford, and Geneva, the unincorporated area in Seminole County and Geneva. And this was a very, very sophisticated operation. You can see there's a photograph down at the end that has names of actually drug dealers who were on call and on duty that day. So much like you would go to work and you would have a supervisor create a work schedule for you on when you were there, when you were going to be there, and what you were going to be responsible for, these drug organizations were actually so sophisticated that they were creating a work schedule, which is one of the reasons why this case resulted in 19 felony arrests and 7 people arrested under the RICO statute for the racketing efforts that they're doing, and we'll talk a little bit more about that. We talk about how deadly this is, and over the past few years we've seen such a significant increase in opioid-related deaths and overdoses. If you look at the photograph here where it has fentanyl and some comparison to heroin, we know that fentanyl is 100 times more potent than morphine and 50 times more potent than heroin. And you look at all of the deaths that have occurred, and in Seminole County alone, there's been 582 overdose incidents in the past 3.5 years or so. 1 out of every 5 people who overdose actually die from the overdose. Nearly 20% of people who overdose die from that. In Seminole County alone, there's been over 1,500 1,500 deployments of Narcan, the antagonist that reverses the effects of the opioid addiction. This is just an unbelievable epidemic that's going on over and over again. You see the middle picture here that is carefully taken with gloves and safety equipment that law enforcement officers and public safety professionals have to use, but pure fentanyl inside there. And to put this in comparison for people who don't understand what's happening is some of these drug dealers are mixing this in their house, in their bathroom, in one particular case of one of these offenders, on top of his pool table inside his house, and it's deadly proportions that's going on in there. So it's almost like playing Russian roulette with this drug. You never know how potent the dose is that you're going to take, and it is just horrific. It is probably the greatest public safety concern that we have experienced in a very long time, In 2015 to 2016, there was a 116% increase in overdoses, 88% overdose deaths. In 2016-2017, once again, more than a 100% increase in the overdoses and 127% increase in overdose deaths. We've done a great job here in Seminole County. We work with our state attorney's office to make sure that there is swift consequences when people are dealing this drug. Particularly these 7 people who are facing RICO charges, there's a minimum mandatory of 25 years in prison, capitalizing on the criminal enterprise of selling this drug out on the street. In Seminole County alone, when drug dealers have distributed this, and people have died as a result of using the narcotic, we've charged 12 people with homicide here in Seminole County for dealing this drug. And we will continue to do that with our partners at the state attorney's office. But this is more than a plea for us to say, if you're out there and you're engaged in this type of criminal activity, we're going to find you, we're going to arrest you, and we're going to be swift with the penalty phases of that. This is really a plea for all of those people who may be out there watching that are addicts or know of addicts or have addicts in your family, to reach out and get some help from somebody. I don't care if you call the sheriff's office or any one of the police departments here in Seminole County and say, I'm an addict or I have a relative that's an addict, what can I do? There's organizations that we partner with that will lend a hand if you don't feel comfortable with contacting law enforcement. Aspire Healthcare, the Center for Drug-Free Living. There are a whole host of valuable resources that are out there to assist with this, to make it happen. I don't know if you can get a shot, but what we had is the 2 enterprises that, again, our investigators have looked and have been monitoring these individuals. Many of the people that you'll see on this list rose in the ranks of the drug enterprise by first serving as a user. They become an addict, they use a drug, they try to find a way to continue their supply of drugs by earning money, and they start selling to others. And it was absolutely disturbing how prolific this is throughout our communities. Think about it. More than 22,000 fentanyl-laced individual heroin packets on the streets per month. More than 750 of the same size packets of cocaine in addition to this, just from these 2 groups. So that's where we're at, and again, I want to thank all of the chiefs of police, because none of this would be possible without the collaboration and the partnership between all law enforcement officers, the support of the local DEA office. We executed 4 search warrants on November, I believe it was November 20th. Simultaneously, we did that with the Volusia County Sheriff's Office SWAT team, the Seminole County Sheriff's Office SWAT team, the Sanford Police Neighborhood Response Unit, executed these search warrants, collected some of the evidence, some of the drugs that you see here. But I will tell you, there wasn't that significant amount to collect, because they were moving these drugs so quickly. As soon as they got it, they were turning it back out on the street. And a lot of the people who are users and buyers were repeat customers. They were going over and over and over again. quite literally, this is a life or death situation, and we want people to feel comfortable that they can reach out if they know somebody who's affected by this. But in the meantime, we're gonna keep putting people in jail. We're gonna charge people to the fullest extent of the law that are doing this. And actually, even from this case alone, there are more people who are likely to be arrested as additional information becomes available in this particular case. Last and certainly not least, in order to combat this, it's more than just enforcement and it's more than just awareness. Here in Seminole County, we have put together a heroin task force, which has been very successful. It involves 25 independent organizations that come together with the sheriff's office, with the city police departments, with our health professionals to do all we can to raise awareness, to make sure that people receive the services that they need to get off of this addiction. Even in our correctional facility, we have a lot of things that are going on in our correctional facility to use Vivitrol and other types of narcotics and drugs to break one's addiction. So when somebody's arrested, they're incarcerated, we know that they're an addict, we're not just gonna let them sit inside the correctional facility and then release them back out into the community. So we have received grant funding, we have the assistance to give them medicine to help break their addiction while they're incarcerated in hopes that they get back out on the streets and live a normal life. So with that, there's some photographs here. There'll be some additional information. We'll give kind of a breakdown of who these players are. One of the interesting things is if you look at a lot of the people who are very active in this drug enterprise, they don't have lengthy criminal records. And if you look at the date of birth, you'll find that a lot of these folks are young. They're born in the late 80s, they're born in the early 90s, they're in their mid-20s, and they're so deeply entrenched with this thing and so comfortable of what they're doing, they acted like they're running their own business. Just like you and I would go to work day in and day out, that's what their attitude was like. So comfortable with what they were doing, and now you have them facing significant charges and consequences for their actions. So with that, last let me say, a lot of work goes into this by our members of CCIB. These are the city police officers and the deputy sheriffs. And I just want to especially note their effort. In order to do operations and investigations like this, these folks quite literally work around the clock and sacrifice their own time and their family schedules when others are enjoying Thanksgiving dinner and all of these things. These guys are working around the clock, conducting surveillances and doing all that they can to make sure that they make these cases and keep our community safe. So I want to thank them especially for making this happen. And with that, I'll open the floor to any questions of myself, any one of the chiefs of police that are here with me today as well.
Sheriff, you said
can you tell us about how they were operating? Were they selling it out of the house, people coming and buying it out of the house, or were they driving and meeting people on corners and selling it that way? There was one house in Longwood that had 62 grams of fentanyl that they found. Would the people just come to the house and get this stuff, or would they go out and sell it?
It was a combination of people going to the house and picking the drugs up, but what was probably occurring most often is these guys that were selling it were delivery guys, and they would typically meet in parking lots like whether it was a convenience store parking lot or just remote locations, almost as if you were going to engage in a sell on Craigslist with somebody and meet at a common location. That's really how they were doing it. Some of these people were repeat customers, so they would meet at the same locations over and over again. And what would happen is the drugs would come into the primary guys' homes. Those are the guys at the top of the list. They would then cut the drugs up, probably mix them up inside the house as well, and get it to the next tier down on that drug enterprises. Based on whoever was on that list down at the end, that last thing where you can see Josh and Dale, and these people were basically saying, hey, you're up today, and any new requests that come in for drugs, you're going to deliver them, and you're gonna make it happen. So they were out distributing these packages and doing it. So to answer your question, combination of both, but mostly they were delivering the drugs to remote locations. They would go out to Geneva. They would go out to areas in Sanford or Lake Mary or Longwood and make this happen.
And Sheriff, you said this was a 5-month investigation. What was that initial tip?
Initial tip was complaints from citizens that there may be some suspicious activity. And that's a wonderful question, because I will tell you, it is law-abiding citizens that see things out of place, that report suspicious activity and bring it to our attention, that help us significantly make these cases happen. So when that occurs, all of our agencies thoroughly follow up on that. We use every aspect of investigative abilities that we have to find out what is going on, and then ultimately result in not only taking action, but taking action that will keep these people from doing this for a very long time. If you think about RICO, minimum mandatory of 25 years, you're looking at a significant amount of time. So that's really how this generated from a citizen complaint about what they believe to be suspicious behavior going at one of these individuals' homes.
Sheriff, I mean, we know that the heroin fentanyl issue has been a dramatic problem all across the country, not just Central Florida. And, you know, we've all covered one event in one county, one event in another county, in another county, another county. But yet it always seems like there's always somebody to take these folks' place. You round them up, you prove your case, you lock them up, there's these minimum mandatories, and maybe they're out of the picture for a couple of decades. But there's always somebody that seems to want to replace them. How do you stop that?
I think you got to break the addiction. I think in order to stop it, you got to break the addiction. What we've seen with this opioid epidemic is many of these individuals, when pill mills were alive and well, became addicted to pain medicine. When we cracked down on the pain meds, they could no longer get it. We had restrictions. We had the system PDMP, which monitored what doctors prescribed, how large a prescription could happen, and we really did a remarkable job across the state cutting down on that. And then they turned to illicit means. I mean, we've seen and heard the horror stories about the boys and girls that were in Boy Scouts and doing wonderful things get addicted to this and never stop. Right now we're on track. We have 55 deaths in Seminole County this year alone, which means that we're on track to once again have an increase in opioid-related deaths. What we need is the loved ones and the family members of these addicts to be their voice and step out. I realize I call for the addicts to say, hey, call us if you need help, if you want to get off the drug. It is very unlikely that that's going to happen. But what is more likely is the family member or somebody close by reaching out and saying, what can I do to help?
Some areas have adopted the strategy saying, rather than play the Russian roulette with the hodgepodge mixture that you may or may not get in this parking lot on Saturday and a different parking lot on Thursday, and actually having places where addicts show up to get high with a dose that's been measured out by the people who are running that facility. Is that an option?
Yeah, I think that's pretty ridiculous, actually. I don't think that that's going to lead to breaking the addiction. I think that, you know, we've seen that actually one of these drug dealers was actually deployed with Narcan himself and had somebody overdose, got called, he administered the Narcan, the drug dealer administered the Narcan with very specific instructions: don't call the paramedics, don't call law enforcement, I've taken care of it. So
that was to avoid detection.
Avoid detection. Avoid detection. And then when somebody is dying and you're bringing them back to life, I mean, to beat the addiction, I think that we should let the professionals who are trained be a part of that. There are medicines that help people kind of break the addiction, counseling and loved ones, but I think that by now, all of us have been affected in some way with somebody that we know that has surprised us with this, and you know, we're going to keep working at it. But I think education and awareness and doing all that we can to break this cycle is what we need to do.
I wanted to ask you about the providing the medicine in the jail to break the addiction. I found that to be really interesting. So somebody gets arrested and they're put in jail, and there's a certain bond schedule that they can meet, they can be released. Are you guys keeping them in where otherwise they could make bond, but you're keeping them in for their own benefit and trying to break the addiction before they can bond out?
Well, let me do this, because we have our guy who's our resident expert. It's going to be Chief Dan Purcell, but Chief Purcell was instrumental in working with our county health director on putting the opioid task force together and is very familiar with this process. But let me invite him up to answer some of those questions, Dave. Sure.
Thank you. Good afternoon. So Dave, the answer to your question is we wouldn't keep somebody in the correctional facility if they have the option to bond. Typically, these are people who have been sentenced to a period of time in the jail, or they're unable to bond, and we're able to get that treatment to them.
So they're serving a county jail sentence already, and so that gives you the amount of time to hopefully get them off of whatever they're on.
That's correct. That's correct. And that's being evaluated by our medical facility staff, so they can evaluate the treatment period that's necessary, also to sustain that when they bond out of jail and go back into society.
It's very interesting. I hadn't heard that before. Thanks.
What's the medicine called you use?
It's called Vivitrol. It's Vivitrol.
Okay.
And basically what it does is it blocks the receptors in the brain that cause the person to have that sense of addiction and the desire to take more opioid-based drugs or heroin or fentanyl or anything like that. So essentially it reverses that effect of addiction. It's been proven to be pretty effective.
Besides the drugs, did you guys confiscate any weapons at all in this?
Yeah, we have one handgun that we confiscated, but there really wasn't that. You know, typically with these types of drug busts and activities, there's a lot of weapons involved and all of that stuff. There really wasn't that many weapons, a lot of drugs, but again, you know, they were so sophisticated that by strategy, they did not want to store a lot of drugs in their home. So what they would do is they would get it, and they had a pretty routine system where 22,000 of these bags going out per month, they knew that we can get a daily supply and quite literally go through whatever they got that day, you know, by the end of the day. So there were some handguns and stuff like that, but nothing real significant in terms of weapons. Again, this isn't the traditional kind of drug dealer that's, I mean, these people really were running a business. And in their minds, they were like, okay, let's do this. And you know what's also interesting is this. You know, we talked about this. Dave kind of asked a question about it. This is one of those things that we can't enforce our way out of this problem. I mean, there's not enough prison and jail space just to kind of keep arresting, because when they come out, they're still addicted. They go back down the same path. This has to be a holistic approach with public safety professionals, law-abiding citizens, private non-profit organizations, the faith-based community. Everyone has to come together to beat this epidemic that's going on.
Can you tie any ODs to these people?
Well, well, we know of one where he used Narcan. We have not been able to determine whether or not there's any overdose deaths, but I will tell you, if somebody dies from taking some of these drugs that they put out on the street, we're going to charge them with homicide in collaboration with the state attorney's office. And that's when I kind of make mention of there's likely to be additional arrests associated with this particular case and these particular groups, but right now we know of the one overdose that had occurred.
So even though Narcan was used on that person,
Well,
that
they
person
died.
died?
So yeah, so overdose, you overdose before you use Narcan. So they had overdosed,
Oh, okay.
and then
It
they used
wasn't an overdose
Narcan to
death.
start breathing again.
Do we know where this is coming from to get in here? Are we following where it's coming from and how it's getting here, and are we going after those people and trying to cut off the pipeline to this?
Yeah, so we try to track it back as far as we can. For the longest time, we saw this coming from other countries and Puerto Rico. Since the hurricane hit Puerto Rico, that's slowed down a little bit. But you know, a lot of people talk about more liberal positioned states with recreational drugs and all that. A lot of these drugs are coming from these states that they're in the United States. They have more liberal positions on drugs. Maybe it's recreational use of marijuana, and a lot of it is being delivered from those other states into the state of Florida. For the longest time, it was South America and these areas, and then Puerto Rico. That seems to slow down a bit because of the devastation on the island in Puerto Rico. And a lot of it is coming from other states that have some form of legalized recreational marijuana use.
Sheriff, do you know the monetary amount off the streets with this? As far as how much these drugs would be, 22,000 bags, how much money that would be?
Well, 22,000, each bag was what, $10, $12. So each one of these individual bags, so $10 times 22.
$250,000?
Yeah. And then you gotta remember that in addition to that, there was, 700, 800 bags per month of cocaine as well, in this group, this enterprise as well.
So you were saying 22,000 a month, right? So, but basically $250,000 a month. So this operation was basically making about $3 million a year.
Exactly.
Was any of the cocaine laced with fentanyl, or was it just the heroin?
Mostly the heroin. And look at the potency here. And I mean, I know you guys have covered this in the past and all that, but I mean, we're just talking about fentanyl. We're not even talking about carfentanil. Even more potent than that. And a lot of times people who are laymen, they don't understand this. I've kind of given a layman example of it. It's almost like, if somebody was baking cookies in the kitchen, and they took a recipe, they took the dough. Well, you bite into one cookie, you may have a whole bunch of chocolate chips in it. And you bite into another cookie, you have no chocolate chips in it. It is just like that. Somebody takes it and mixes it up, and it's rich and pure in a particular area, and they take a bite of that, and that's it. That's all it takes. 1 out of every 5 people who overdose die, even with 1,500 deployments of Narcan in an effort to bring people back to life. 1 out of every 5 people who overdose die.
Sheriff, on that 1,500, I know you threw that number out earlier. I was going to ask you afterwards, but since you brought it up again, over what time period?
That is this year. So
Okay. All right. Okay. There wasn't a time frame for that 1,500.
Oh, I'm sorry. 3 years, 10 months.
Or there's that.
Yeah. 3 years, 10 months. Any other questions? Thank you guys for your partnership and what you're doing. Thank you for going out there and covering this. The greatest thing is if we can increase awareness, if we can ask those families, those loved ones of people who have people in their homes that are addicted to this drug, to reach out to somebody for help. Call us. We're not going to send investigators down to search your house. We're going to put you in contact with people who can give you and your family the help that they need. Our job is to save lives as well as put bad guys in jail. This is the most prolific public safety concern that we have across this country right now. Thank you for covering this.
Sheriff?
Yeah.
So